Sherica Hymes, and I am the founder of the Total Woman Summit and your host for this free virtual workshop series. Welcome, it's Wednesday night. Happy Wednesday, people. Tonight, we are so fortunate to have with us two dynamic powerhouses who are definitely leaders in their industry, on the front lines in the healthcare industry, by way of information or just by way of medicine. And so we are going to go ahead and get this party started. Ladies, I'd like to welcome Dr. Carla London. How are you, Carla? You can bring yourself off mute now. I made her put herself on mute.
Hey, everybody. I'm great.
How you doing good?
I'm doing good.
Good. And then we also have with us Dr. Nieika. How are you, Nieika?
Hello, everybody.
Hey. So tonight, we are going to be talking about the COVID-19 mythbusters. We are going to separate the facts from the fiction. And we all know that there has been a lot of fiction going on. So before we get started, we're going to ask that you guys will go ahead and participate and let us know if you can hear and see each one of us okay. And I have my good friend, Shamel Evans, who will be taking all the notes for us in the chat. So you guys, they want to make sure that you're screenshotting all this information because she's going to take the notes so I can stay focused in the conversation. Can you guys hear us okay and see us okay? Yep. Dr. Henry said she can hear and see us. So let's get this party started. I want to let you guys know the rules of engagement. Number one, we're going to have fun. That's rule 1 through 10. Then rules 10 through 20 is going to be everybody participates. If you've got questions, you got to go ahead and drop them in the Q&A. We're not waiting until the end to answer your questions. This is a conversation. We're just the only
That's
three.
right.
But we're talking to each other, so drop your questions in the Q&A or you can drop them in chat. And then last but not least, we're going to keep it real and keep it 100 on this call because that's what we do. That's why 3 of us. So Carla's the 1, I'm 0, Nieika's the 0, and then Nieika's the 1, then I'm 0, and then Carla, you get the picture. You know what's happening. And for those of you who are new to the Total Woman Summit platform, the summit was created to empower women through education, connections, and community. And as a commitment to educating you, that's why we have leveraged the women in our community to make sure we're talking about the things that are important to you. And right now, that's COVID-19 all across the world to the ends of the earth, all right? So let's get to it. Dr. Carla London, tell us a little bit about yourself.
So first off, I'm a native Memphian. I have been fortunate to take care of individuals in the greater Memphis area for over 20 years. I absolutely love what I do. One of my passions is empowering people and just providing education. Health literacy is extremely important to me. And so anytime I can be used to share news and correct information, I take that opportunity. So thanks for having me, Sherica.
Thank you for being with me. Of course, you know I love me some Carla. And then Dr. Nieika, tell us a little bit about yourself.
So I'm also a Mid-Southerner. I actually am from Chattanooga, Tennessee. I came to Memphis to study school here, stayed in Memphis for a while, lived in Birmingham, and now I'm back in Memphis. And I work as a health administrator. I've worked in various sectors from academia to the public sector, to the private sector. And certainly I also have a passion for empowering women and for health education and health literacy. I would also say that part of my story is being a cardiac arrest survivor. So as a patient myself, not only do I have the background expertise from going to school and getting a PhD in health promotion, I also have that grassroots experience from being a patient and being on life support and trying to navigate the healthcare system myself. So certainly, I guess I want to start by just saying I don't want to come across as if I'm the expert as it relates to everything infectious disease related. This is a conversation. I'm going to talk to you guys about the stuff that I've heard and what I know and what I lend the truth to be. But by the same token, we want this to be very participatory. We need you guys to be engaged and talking so we can have an active dialogue.
Well, thank you so much. And again, welcome, ladies. And listen, we don't want to gloss over that. We want to thank God so much for bringing you on the other side of that. And we're so happy that you're here to
Come on now. Come on now.
Tell your story. That's what we do. And you don't have to worry about these ladies participating because they are already dropping these questions in the Q&A. But first things first, let's lay the foundation. Nieika, why don't you tell us, what is COVID-19?
Now, many of you probably already know this, so we're not going to spend a lot of time here, but we wanted to kind of get some baseline information. So this is a respiratory virus that's easily spread person to person. I think what's important to note is that the coronavirus has been around a long time. There's many forms of the coronavirus. But what you hear now when you hear the word COVID-19, that's a new form of this virus. That really got the name in February of this year. The World Health Organization, they deemed it COVID-19 because the CO stands for corona, the VI for the virus, D for the disease, and then 19 from the year that it's really manifested itself. And really what's important to note about this is that this virus is easily spread. It can range from no symptoms at all or mild symptoms to very severe illness. And it's a social pandemic that we're dealing with now. It's a global, if we've never heard of it before, I think we all realize how much we're global citizens. And so what impacts someone way across the world also impacts me right here in Memphis, Tennessee, and you wherever you present in the world.
Absolutely. Thank you so much. And let's just recap that, Shabelle. I want to make sure we get that in the notes. The CO stands for corona. The VI stands for virus, and the D stands for disease. And the 19 is the year that it manifested and that they discovered that this strand of the virus existed. And listen, the reason I feel so knowledgeable about that is because Dr. Teresa Woodard got me all the way together this morning in our about COVID-19. So we dropping knowledge out here. All right.
We dropped the facts.
Yes, we dropping the facts. So now let's talk about why is it called a novel virus? Nieika.
Novel is simply because it's new. It's a virus that we haven't seen before. I think really what's really scary about this virus is how it's manifested. And once it's in a human, and I think Carla's going to talk a little bit more about the symptoms and signs once somebody has it. But we've never seen this virus, the coronavirus, take shape in a human the way that this virus has. So novel simply means that it's new. There's lots that we still are trying to learn and determine so that we can make better judgments, so we can come up with better preventive measures, and even social re-engineering. How do we get back out? How do we let people back in the workforce, in schools, all of that? We're trying to figure that out because this is new. So that's what novel stands for.
Novel means it's a new virus. All right.
That's right.
So let's go ahead and talk about, let's do our first fact or fiction. So one of our participants says, I heard that by putting your head over a bowl of steaming water, like a facial, it will help with killing any virus that might be in your nose due to heat. Who is that? Or is that going to be Nieika?
Nieika, you want to take it or you want me to take it?
Well, I've already talked, so you can speak first.
Okay. So that's a myth. We'd like to think that hot water is, especially when grandmama said hot water will work wonders. But unfortunately, hot water is not going to take care of this one. It's a novel virus, as Nieika mentioned, and soap and water, absolutely. Hot water and soap and water, cleaning your hands and cleaning your face will work, but it's still not going to stop the spread of this disease. It's a respiratory illness, and so it has all of these different orifices in which it can pass. So through the nose, through the mouth, when someone is coughing and breathing in. So the hot water, as much as we would like it to, mixed with soap, it can clean your hands, but not taking away that. So
Okay. Well, thank you. So we have busted our first myth, and that's what we're going to do all night. So you keep dropping them, and we're going to talk about them. So the first myth is no, giving yourself a facial will not clear the coronavirus out of your system. What it will do is clean out your pores and give you better skin. So there we go.
That's right, Sherica.
Thank you, Sherica.
Right. Yes, right.
But no bad questions. No bad questions.
No bad questions. That's why you put them in Q&A, and we're going to keep them definitely anonymous. I'm not going to say who you are. So now, Dr. Carla, would you tell us what the signs and symptoms are of the COVID?
So since this virus first came about, the signs and symptoms have changed significantly. There are more and more symptoms that's being added on every time you turn around. So initially, you probably recall them saying that it was cough. If you have cough, if you have fever, if you have shortness of breath, those are the classic signs. And while they remain the classic signs, additional signs, sore throat was mentioned at that time as well, but it's changed so much. Now one of the signs and symptoms that is seen all over the place is loss of sense of taste and smell for no reason at all. So you may lose your loss of sense of taste and smell. That's an issue. One of the other things, of course, headache, fatigue, those things are signs and symptoms, but there have been some really odd signs and symptoms that could be quite scary for anyone. So discoloration of your digits, like your toes.
Wow.
So in some of the pediatric populations, there's been some discoloration in your toes, which is kind of scary. The other thing that I find to be extremely bothersome, our elderly population is at risk for this disease, and they're very vulnerable. Their immune systems are very weak and fragile, and so their signs and symptoms are pretty subtle at times. They may have central nervous system disturbances, and I'll tell you exactly what I mean. They may start to have mental changes, mental status. Yes, and off balance, those types of things. But of note, I've noticed, and this is, I think, been most frightening to me, is that young individuals and middle-aged individuals in their 50s, 40s, there has been a rise in strokes, and those individuals are COVID positive, and several have not had pre-existing illnesses. So this disease is very vicious and very concerning, and all of these multiple changes cause anyone to be extremely nervous and even providers to have pause. So
can I add a few things to that, Sherica?
Absolutely.
So one of the things that Carla and I talked about prior to us meeting with you guys is that how important it is for us to be checking on our seniors, those that are in our families, those that we have connections with through, our religious affiliations, those in our neighborhood. Certainly if there's going to be signs as small as mental changes, even though we're supposed to be social distancing, which we all want to adhere to, it's very important that we stay connected to our senior population so that we will notice someone if they're at risk. So that's one thing I wanted to note. The other thing I wanted to note is that there are some major signs, warning signs that you need to get to in hospital quickly. So if someone is having trouble breathing, if they're in persistent pain, as Carla said, if they're having trouble with confusion or you can't arouse them, those are things that it's really important that the CDC is recommending that those persons seek emergency care immediately. So there are some symptoms that you can self-care, some of the ones that Carla talked about earlier at home. There's others that you really need to be in a hospital to get the proper assistance for. And then the third thing I will say is that these symptoms can manifest at different times from the time that you actually contracted the virus. So you may interact with somebody at one period, and then 10 days later, you see these symptoms. So the signs and symptoms don't always manifest from the point of interaction with the virus or with a person that has the virus and manifestation in your body. There is what we call an incubation period. And right now, the world health leaders are saying that incubation period ranges from anywhere from 2 days to 14 days.
Okay. Thank you so much. I'm glad you said that. But we also want to make sure that we stress that if you have a lingering headache or a lingering fatigue that you can't seem to get over, and that's unusual for you, you should also contact your doctor. And one of the things that Dr. Teresa Woodard shared with us earlier this morning is COVID toes in children. They're finding that in pediatric medicine, that the toes look a little bit swollen. They're looking a little bit like sausage toes. You do not need to dismiss that in these children. If you see it, make sure that you spread that word. And that's another way that it's manifesting itself in our pediatric population. So, and they're not sharing that a lot on the news. So she said that. That's not Sherica information. That's from our earlier session with Dr. Teresa Woodard, who's a medical doctor. All right, so let's answer 2 questions really quickly. So factor fiction. I heard that body aches and GI issues can be symptoms. Is this true?
Absolutely, they are. That's one of the extra things as well is GI symptoms. Some individuals have diarrhea and vomiting. So yes, a host of GI symptoms. They just spread across the gamut, and it's very concerning. And those symptoms, too, can range from very mild symptoms to very severe symptoms. One of the other things that we failed to mention, but that is almost a telltale sign as well, is as these respiratory symptoms progress, you also see on chest x-rays where these individuals have pneumonia. It can be bilateral pneumonia, which is very concerning as well.
And by bilateral pneumonia, Dr. Carla, means you have it in both lungs, right? You also have to go ahead and throw a doctor in front of my name, too. Come on.
Sherica.
I was just joking. I have a memory like an elephant, so every conversation we've had, I'm just retaining the information.
And for the layperson that hasn't got diagnosed with pneumonia, they just may have a persistent cough. So if you're having a persistent cough, that's something you may want to get looked at right now.
Awesome. Thank you. All right, here's a question, not necessarily fact or fiction. This is just a question. When is it okay to go interact with those in the vulnerable category, aka older, they have hypertension or asthma?
You know, I'll be perfectly honest. You know, this social distancing thing, and we're going to talk about this more, is real. Because, unfortunately, some individuals that carry the virus are asymptomatic, they may start off not having symptoms at all, and then those symptoms may progress. It's really challenging. I would encourage individuals to really consider using FaceTime, Duo, and different things like that, because right now we're still at such a fragile period that you really don't know whether or not you're exposing a loved one to the virus. So it's extremely important to keep those things in mind. And I mean, that's way when past the stay at home, when that kind of starts to dissipate some, I just ask that you still use wisdom with regards to that and try to use other methods of communication.
Okay.
Because even though we want to show them love, we don't want to put them at risk, right? So at this point, it's really important that we socially distance from everybody, not just those at highest risk, but from everyone, until they get a better handle on things and really understand where things stand in this country is related to this virus. And so, as Carla said, being creative. I don't know how many of you all are on social media, but if you are, I've seen so many creative ways that people have celebrated their seniors, they've celebrated their children's birthdays, they found ways to have girlfriend time, using technology or driving by to do events. So this is the time to be creative, think outside of the box, but we want you to stay connected, but stay apart.
Absolutely. Okay, so let's get to this next question. Asymptomatic or being a carrier and virus transmission. I will know if I have the virus because of, asymptomatic or being a carrier and virus transmission. I think that's going to be you, Dr. Carla, right?
Yes, and I think we talked a little bit about that, that individuals that are asymptomatic can still potentially transmit the virus to others. And Nieika mentioned that window of time. It may be 2 to 14 days when you are infectious. And as I mentioned before, coughing, all of those things, put you at risk for spreading the virus to someone else. So that period of time is a very fragile period of time, and that's why if you have symptoms, for the sake of your loved ones and everything, you definitely have to keep your distance. So you can still be asymptomatic potentially and spread the virus to others.
Thank you. All right, so let's talk susceptibility and groups that are at greatest risk in the aging population and those with underlying conditions. So you want to talk to us about that, Nieika?
Sure. So I want to start by just saying we should all be clear that no one is exempt from this virus, right? So it's not one population that can say, the virus won't impact me or anyone in my family or my loved ones. Not true. But there are some populations that are at greater risk for poor outcomes if they contract the virus. And those groups include just being in the male gender. I don't know if you all have noticed, but lots of males have been the folks that are in these infection and even death rates related to COVID-19. But the aging population, folks with underlying conditions such as diabetes, asthma, and even heart disease, a person like me, I'm at a greater risk for a poor outcome if I were to contract the virus. And then it's unfortunate, but we've also seen, and this is really, again, very new data, but it looks like that folks that are in certain racial and ethnic groups are at higher risk for contracting this virus. And so when you look at the data, if you don't mind, Sherica, I could share a little bit of the data that I've seen as it relates to African Americans. So some data that I've seen is that, like in Chicago, early data shows that 50% of the COVID cases and nearly 70% of their deaths occur amongst African American individuals, but African Americans only make up 30% of the population in Chicago. So that's a disproportionate number of infection and death rates. Louisiana, 70% of their deaths occurred amongst African American persons, and African Americans only comprise about 30% of their population. And then in Michigan, 33% of the COVID cases and 40% of the deaths occurred amongst African American individuals, and they only represent 14% of the population in Michigan. So It's the same as can be said of New York, because we hear so much about New York being the epicenter of all things COVID. Same data. As a matter of fact, we've seen lots more numbers of poor health outcomes for both African American and Hispanic population. And so your question may be, why is that? Well, it has a lot to do with health disparities. And I don't know how familiar you guys are with health disparities, but health disparities are preventable differences in the burden of disease, injury, violence, and the opportunity for optimal health that are experienced by socially disadvantaged populations. So in layman's terms, because African Americans already have a higher incidence and prevalence of other conditions, such as the ones that we said are highly related to poor health outcomes for COVID-19.
And let's just some of these poor health outcomes may not be because you yourself have a poor diet. It may just be genetic. You have a genetic predisposition to a lot of these things, because we're not saying that everybody's not eating poorly. Everyone's not managing their diet. Everyone's not exercising. Some of this is just disadvantage because genetically you've been predispositioned to something. And that's just not, to Nieika's point, not just for African Americans, that's just for other racial ethnic groups. So we want to make sure that we point that out for you guys as well, and that you do make sure that you pay attention to the data. But the myth that we wanted to definitely bust with that is that you are not immune to this disease because you are of a certain or specific ethnicity. All of us are at risk if we do not properly take precaution, if we do not care for ourselves, and if we do not do the things that we need to do to make sure that we're taking every possible preventative measure. Right, ladies?
And
That's right.
Yeah, and Sherica, this disease, as you mentioned, does not discriminate at all. We know that some individuals have been, it's been consumed with this, but also just even individuals that classically are healthier than oxes, that's doing great or what have you, I've seen them leave this life as well. And so this disease is so vicious and it's so different. And that's why we really, really need to take it serious because
That's right.
And it has impacted every age, from small children to the elderly and the in-between. So, yeah, we just have to take it really seriously.
So this question is going to be for you, Dr. Carla. If you're asymptomatic, can you still get sick enough to die?
That's an excellent question. That's a really good question. So the thing that I've seen, and no one can put a date and a time on death, but these individuals have gone from being asymptomatic to having aggressive symptoms within hours.
Wow.
I looked this morning I was listening to a healthcare provider express and talk about his particular story. And he started off, his temperature had been taken, no issues at all at his job. Temperatures are taken. His temperature was taken. He had no temp. He and his wife enjoyed dinner that night. A couple of hours later, fever. Next hour after that, shortness of breath. So, no one can determine how long you being asymptomatic will last. That could be a day, that could be 2 days, or what have you. And so because it progresses so quickly, it's kind of hard to say that you're out of the woods because you can be asymptomatic this one moment and full-fledged fall out the bottom the next. So I hope that helps.
That does help, and that actually brings me to another question, and I think it's important that we answer this, and I'll direct this to you, Dr. Carla, as well. This morning there was a lot of confusion around this is a hoax or this is just an aggressive version of the flu. Can you address that?
Yes. So totally different virus than the flu. However, I will say this, influenza, which is the flu, can be devastating. But this disease, if you want to put influenza on steroids, that's the way, you think about this disease. And so it's very different. It still impacts you with regards to respiratory symptoms. But, going from 0 to 100. So it's a very different virus. It's tested differently, and we'll talk about that a little bit later. But it's completely different. And so, yeah.
Okay. And Dr. Nieika, I'll address this to you. When carrying for the let me see what they're trying to say. Okay, when carrying the elderly food and those in a vulnerable population, is it okay to take them the items that they need as long as you do not go into the home and that you're staying 6 feet away?
So I would say yes. Now here's what I do. Let me just put it in layman's terms. I'm one because I'm staying clear of all the stores and all the pharmacies, anywhere I think could be an incubator for the virus. And so I order my food on Instacart. It would be the same thing as you bringing food over to my house. But I let the people put the food on the outside of my home. I let it sit there. I spray the food down, spray the bags down. I wipe down. I'm taking all kind of precautions because it's not just that a person can cough and the virus, you get the virus in that way. Even talking, there are droplets that come out when people talk. And this virus has been shown to live outside the body a lot longer than most other viruses. So I would say we want to take care of our elderly. We want to make sure they have what they need, the resources they need. So certainly do your best to get them what they need, but I would definitely stay 6 feet away, and also be sure you're educating them on what to do to clean their items when they get them from you or anybody else. If they're ordering things online, I mean, folks at the Amazons and everywhere else, I won't throw Amazon on the bus. I would say any mail carrier at this point, the virus is not exempt from those employees either. So we've all just got to take precautions by wiping down, using our Lysol, our Clorox wipes, our spray, to keep things as clean as possible and to try to do everything we can do to prevent ourselves from getting the virus.
Absolutely. Thank you, ladies, so much. So let's go to our next myth, and I'll direct this to you, Dr. Carla. Let's talk a little bit about COVID-19 testing and surveillance.
Oh, yes. Good. So with regards to the COVID-19 testing, so I'll just say this, there are numerous tests that's out there. If you may have heard, but different companies are producing a variety of different tests. But for the purpose of this conversation, I'd like to just kind of mention two tests that are used to detect COVID-19, so I'll share that with you. So the first thing is a diagnostic test. That diagnostic test for short is called a PCR, and you don't have to remember those things. But with that diagnostic test, and you've probably heard of it, it's a nasal swab, okay? So that nasal swab is used. So when you test for COVID, you are testing the nasopharyngeal region. So your nose, the inside of your nose. So there's a swab that's used, and it's a technique as well. So you go into the nose, and you go, I can't describe it, but you go pretty far back. It sounds scary.
It's pretty uncomfortable, right? And it can be painful, because I've heard it's uncomfortable and painful.
It's uncomfortable, but it yields results. So
Okay.
so it can be a nasopharyngeal swab, and some individuals do a mid-turbinate swab, which doesn't go back as far, but it's a swab. And there's a technique. You swab the area, and it really goes by faster than you think, for about 10 seconds. And so that particular test specifically tells whether this patient is positive for COVID or not.
Okay.
So that's one of the tests that's used. Another test that's used is an antibody test. And so with the antibody test, individuals are checking to see if an individual has had a disease. So, you know, our bodies are these unique machines that when different viruses and bugs come into our body puts up its dukes and it's fighting. And so what happens is the body builds antibodies to fight against that. And so that antibody test is a serological test. So that means that it's drawn by blood.
Okay.
And so it's being used quite a bit in New York because what they're able to do is to kind of test how many people are positive. And I think that it will guide interventions in the future. So if there's a pocket of individuals that are positive, then perhaps they'll be able to implement additional interventions for those different populations. So those are the main two tests that are done. Results usually come back within an hour or a couple of hours to 1 to 2 days. So it just really depends. But those are the main two tests that are done to tell us more about the virus and whether a person is positive or negative. So let me say this. So there's not a test that's 100% perfect. So it's not. And so as I mentioned, one of the things is there are a couple of factors. So rarely do you have false positive tests, but you can have false negative tests. So those false negative tests means that a couple of things it could mean. It could mean that perhaps that person was screened early in infection and it did not pick it up. It could mean that the swab perhaps was not collected. It didn't have enough sample on there. So it could be a couple of things that can yield that, and it can also be what we call inconclusive. If it's inconclusive, then it's probably bad because there was not a good enough sample that was done. So when you have a test that's inconclusive, it's very important that you repeat the test.
Wow.
But one of the things that you have to remember, and I really mean this, I want you to trust your body. I want you to trust your gut. If you have a negative test, but you have positive symptoms, I want you to be proactive, isolate yourself. Call your doctor, call the testing center. My symptoms are getting worse. You need to have the test repeated. So it's not a perfect, there's nothing that's perfect. But it does give accurate results, but there is room for error with anything that you do. And you know, Sherica, one of the exciting things that I saw before, and I was like, this is going to be interesting. I looked at soon the CDC is looking into releasing home-based tests for individuals to do at home. So that's going to be very interesting. I think it's going to require a lot of education to ensure that individuals are collecting. But if you think about it, it definitely helps to decrease the risk for those that are testing. It helps decrease their risk of this virus and acquiring it.
Yeah, you know what? So I'll just tell you, I don't know how I feel about that, Carla, for a lot of reasons. I'm going to tell you why. This is going to be so far-fetched to deal with the people. Is we trust these people to know that they don't have sexually transmitted diseases, or if they do, to not transmit them. And folks don't do a good job with that. I don't know how I feel about people testing at home and believing them when they say, no, I'm negative. No, I don't trust you. I'm going to
I hear you, Sherica.
You have a point. You have a point.
Right. That's just my crazy. I will own my own crazy. But so let me ask this question, Carla, before we punt to Nieika. This is a question from someone. When is it important to see if you have had the antibodies? And if you have the antibodies, what should you do then?
Okay. So the antibodies, it's not that you decide, I need to check and see if I have the antibodies. It's not being done everywhere, but it's a test and the reality too is that you can have you can also have a false negative antibody test because it really depends. It's not a test to see if you are COVID. It's a test to see if you have had the disease before. So it's just like anything else. Your body has to mount antibodies, and it can take a week, it can take several days for you to mount antibodies. So even if that test is done, then it's not necessarily accurate depending on when you get it tested, done. So like I said, the antibody test is being done especially in places to give more information about the number of people that have been tested. And the antibody test is never a test that you use alone to test to see if someone has COVID.
Okay.
It has to be done with another test.
Sounds good. So to clarify, that's not something that you get to decide. It's certainly something that your healthcare professional will decide, and you cannot take your own Q-tip at home and swab your nose. And
take
out
it in to your doctor. Don't do it.
And take it in to your doctor. This is not how this works, people. Get under control, all right?
So I want to say something about testing too, Sherica, before we move off that.
Okay.
I just want to say that, you know, I'm sure we have folks that are here where Carla and I reside is in Memphis, Shelby County area, but there's probably folks on the line that are from other places as well. So I would say to really get engaged with your local health officials to learn where the testing sites are and how they operate, because in preparations for our call today or a workshop, Carla did a little testing herself just to call around and kind of get information about how prevalent testing is going on, where it is, the time, and how, whether or not you had to have symptoms or didn't have symptoms to get tested. And it varies from testing sites, from each testing site. So I would say, you know, if you need to know more information, if you're having symptoms or you have a family member or friend that's having symptoms, or you're in a position to influence others to talk to them about getting testing, so testing and the importance of testing in your local area, you want to check with your local health officials so you can learn where the testing sites are and how their processes work. Some of them you have to have an appointment. You can't just show up and get tested. Some of them you have to text before you come. Some of them, the process is varied, is my point. And so I want you to get engaged. If this is something you need to know, certainly there's information that's being published on a day-to-day basis, because this is, again, since this is so novel, things are changing at rapid pace, right? At a very rapid pace. And for you to really stay abreast of what that information, you need to check on a day-to-day basis, depending on what you need to know. But I would check beforehand, before just pulling up to the location that you heard on the radio 2 days ago. Yeah. They may be at a different place, or they may be full for that day, or, you know, there may be a whole host of reasons why you're going to be disappointed on whether or not you can get the test. So save yourself the gas, even though I know gas is simply cheap right now because nobody going anywhere, but doing your homework before so you can find out what it looks like in your area. And also, look at your numbers. You know, we're all trying to make informed decisions about when it's time to come out, when it's time to stay in, you know, whether or not I should be returning to work, whether my job wants me to or not. The only way you can make informed decisions is if you know the data yourself. And this is data that's public. It's public information because this is a public health pandemic. So you have the right to look into the information around what does the numbers look like in my local area.
Mm-hmm. That's good. And one of the ways that you all can do that, so for those of you who may not be clear what we mean when we say your local healthcare professional, you can check with your local health department. You can call your local doctor's office if you have a primary care physician, or you can use the information on your insurance carrier to find a primary care physician if you need to, and then they will be able to share that information with you as well. So we just want
information, Sherica. That's great information, and you were dead. You hit it dead on the head. The local health department will show. It's a whole list on their website, a list of testing agencies. Some of them you just text, and then, you know, they ask you a series of questions or what have you, and your appointment is made through there. So some of them I tried to call, and I could not reach them, but it's definitely there and available.
Thank you so much. Okay, so here is a question. Is it important for those with lung cancer or just cancer in general to be social distancing from others and refraining from going in the public or having guests in the home?
I'll take that one, and I'll just say it's important for anyone with a weakened immune system. So certainly having cancer or being in cancer treatment can weaken a person's immune system. But there's lots of other illnesses. You think about in the African-American community, lupus is a big illness that kind of weakens the immune system. There's lots of different illnesses where you know you may have a compromised immune system. If you do, you're in that group of folks that are at greater risk for worse health outcomes as it relates to COVID-19. So I would say, yes, it's really important for those persons to stay away, adhere to the social distancing guidelines, and also do whatever they can do to take preventive measures to not contract that virus.
Absolutely. Emphysema, COPD, all of those.
That's right.
If you have an it, then you need to be practicing social distancing, okay?
That's funny.
All right. So there you go. And that it is any underlying health condition. I have asthma. True story. I have chronic asthma. So therefore, I am really over the top with how I'm being exposed because I already, you know, from a respiratory perspective, so it's difficult for me to breathe in other situations. So I certainly can't afford to contract the virus. So just so you all know, that's what we mean when we say it's an it. So that's what I mean when I say it's an it. The doctors did not say that. Sherica said that, a non-medical professional. So I can't taint you guys' good reputation. All right. So that's a perfect segue into our next question, and I'll direct this to you, Carla. What's the difference between social distancing, quarantine, isolation, and stay home?
Okay. So how about we take the easy one first? Stay home. Stay home means just that.
Pretty much.
Whether you've been exposed, it doesn't matter. Staying at home is just that, chilling at the house and keeping your distance from other people. So quarantine means it describes if individuals have been exposed to the disease but they haven't shown any symptoms at all. They could have symptoms at any time. That's separating someone who has been exposed to the disease from other individuals who have not been exposed to the disease. That's what quarantine means. So isolation is a little bit different. Self-isolation, isolation, period, is just that. Separating yourself, those are individuals who have symptoms of the disease or they have COVID symptoms. Those individuals are isolating themselves from the population of people that don't have any symptoms or have not been exposed. Right. These terms are extremely important, and social distancing is exactly what we've all been doing now. And even when you are 6 feet apart from someone is real, because we know that droplets, sneezing, all of that stuff can jump from one end to the other, and really separating yourself. And so one of the things that has really been bothering me, I saw a video recently, and I won't call out the city. I love the city, actually.
Ooh, I almost want to call them out.
It was a house party.
Beautiful.
And the smack dab in the middle of isolation, in the middle of social distancing. And I just wanted to just do the ugly cry, all jokes aside, because it grieves my spirit, to see so many people that we love and respect who have left here. Oh, my goodness. One of my gospel singers that I absolutely love is gone. Please, I promise you, and hear me well, even when the government relaxes things, please stay woke, like the young people say. Don't relax. It's so real, and it impacts all of us. And guess what? Where you think you're robust and you're strong and your system, you got it going on, I ain't never had no cold. You got other people that love you that are around you. And as I said, you can be healthy as an ox, and this disease can impact you. So please take this seriously. Look at my hair. My eyebrows are jacked up. Look at mine. It's a hot mess. But guess what? I would rather, and I love stylists, but I would rather honestly abide by the rules of social distancing than to have my hair done and my eyebrows laid when I lay down in my casket.
See? So you will be doing your hair and nails done for your own funeral. You will be the first person to pick out your hairstyle and your nail color for your own funeral. And we're not trying to live that life. You all are important to people that love you, and just because you are may not be concerned about it, it doesn't mean that other people aren't concerned about it. So that also is a perfect segue into this other thing, because so basically this is a myth. Is this fact or fiction? I'm good because I'm only hanging out with my close friends and family.
I'd like to take this one. You want me to take it, Carla?
Go on, honey, because I got to go on.
Carla was getting ready. Okay. The way Carla just leaned forward, I knew she was about to do it.
I was gonna use Sherica's sex analogy. So in STI transmission, we talk about it's not just who you sleep with, it's who they sleep with too. It's the same concept. Everybody thinks, well, I'm only going over this girlfriend's house, or I'm only hanging with this family member. But, you really can't quantify how many persons that person has been exposed to. So when you go see that one nail tech, and that nail tech saw 20 other people that day, and those 20 other people had 20 other people in their home, and you have magnified your risk for contracting this virus tenfold. It's not worth it. It's not worth it.
So the answer to that question is no, it's not okay if you're just seeing the people that you know, the friends you trust, the folks you're cool with. Basically, the way that the doctors, those present today, and the one that I spoke with this morning, shared with me was, if these are not people that live in your home, these are not people that you should be interacting with. Is that correct?
That is absolutely correct. And you know what? Nobody loves a good cookout, and I just love it.
More than me.
I really do. I miss just my friends coming over and hanging out. But we can blow smoke signals. We want to see each other on Thanksgiving and Christmas. So we need to do something different to get a different response. Seriously.
Right.
This is real, y'all.
Okay. So we're going to, we have 10 minutes and we got 2 questions that we absolutely, 2 myths that we absolutely have to debunk. So let's first ask this question, though. This is a question from one of our attendees, and they ask, is this a myth or fact? Can COVID be ingested when eating via takeout?
You want to take that one, Carla?
I'll be glad to. So let me just say this. I can understand that being a question because you're like, these people are standing over my food cooking. But I want you just to remember that it's not a foodborne illness. And so, to my knowledge, all of this is evolving still, but there have not been any cases of COVID being transmitted through food. So, yes, so I would say still, you can still have your takeout, but it's not a foodborne illness. And one of the things you got to kind of remember as well is that the issue comes in with our mucous membranes. So if we are, doing whatever and touching stuff, and then you put it up to your mucous membrane in your nose. That's why they say keep your hands out of your face and that kind of stuff. It's that when that virus gets to that mucous membrane, you have a serious problem. So,
and I think the restaurants. Okay.
Wait a minute. Hold on, Nieika. You got to say what you're about to say really quick because I got to ask these other 2 questions and then we got to debunk these other 2 myths. Go ahead.
I was just going to say, I think that the restaurants now are having to adhere to strict guidelines to keep their staff covered or to have the protective gear on as they're preparing things. So I think that was put into consideration. I know it's scary because we even saw the closure or the potential closure of the meat factory, but I think that more has to do with the fact that those folks there could be spreading the virus in a close contained environment, not so much that the virus is getting on the food and coming to us. So we need to be clear, as Carla said, that it's not so much in it being ingested and we're getting the virus from eating food, more so that we're spreading it from person to person.
Okay. Thank you.
But Sherica, you ought to see me in while London putting stuff in the microwave, turning it on.
Look, you too? Like, I am going to air fryer that virus out of there if it costs me everything I want. My fries are a little bit more crispy, but here's a good way for you to make sure. If you go pick up your takeout food and they don't have on any PPE, say no thank you, get in reverse, and keep it moving, okay? Now, these next 2 questions can be answered with a yes or no.
Okay.
All right. So, Carla, can COVID enter the body through your pores?
Through your pores?
Yes.
Mucous membrane, that's not necessarily a pores, but I think it's very important because, like, this is a novel virus to make sure that you have on proper PPE. Like if you're in the healthcare field, we're gowning up with stuff as we're doing, certain procedures and that kind of stuff. But I would say mucous membrane.
Gotcha.
No, not pores.
Okay. All right. This is the last question, and then I'm going to do our last 2 myths. Is ulcerative colitis and thyroid disease in the vulnerable category?
Any other disease, when you have another disease that's already taxing, it takes the body, effort for the body to really fight against or to stay healthy when you have an ongoing chronic condition. So I would say anyone that has a chronic condition should be very leery of this virus and taking all precautions to try to prevent contracting the virus.
And I want to add as well, think about this. Any outside thing like this virus will tend to exacerbate everything. So where you could have something that's controlled, you can have multi-organ issues. So it's impacting your lungs, So Sherica, about my history of my COVID-like experience in the past with my sweet, amazing husband. So I'm just saying it can tend to impact the body, all different types of organs. So just be careful.
Yeah, be careful. All right. So this is one I bet you didn't expect when we were talking about COVID-19 people. Carla, talk to us about COVID-19 and sex.
Ooh. Okay. Ooh. So let me just say this, y'all. So that you won't find, the literature does not have a whole lot about this. But what I will say, and so many things are evolving. I do know that several of the studies showed that there was COVID, that the rectal specimen. So it can be in the rectum or what have you. So I'm not here to describe what anybody's preference is, but I just think you need to be careful. And I think that this is not really the season. And I'm not, you know, it's easy for me to say because I got a husband.
If you are this ain't fight season.
Okay? I would not. I wouldn't be hooking up with new booze in this season right now because you just don't know. I mean, that's just my take.
This is not the time, people.
And guess what? You still need to create a barrier between you and somebody else. So slobbing somebody down
not in your household.
I'm just saying.
You said it. But we want to make sure, we want to have real conversations because we want you to be safe. And something that Carla told me the other day while we were preparing for this was that there are new studies, and she'll correct me if I'm wrong, that this virus can live in fecal matter longer. And so if you're even having anal sex, which is why we brought up the sex thing, because listen, that's why if it's a same-sex partner, or even if it's what you and your honey for the favor, you know, you just got to be careful out here in the
And that's perfect, Sherica. And it is fecal matter, not rectal per se, rectal tissue, but you do have viral shedding that can happen. But yes, absolutely fecal matter. And so, yeah.
Okay. Well, listen, people,
it's real, people.
All right. So now, what can we do to continue flattening the curve with social distancing, protective gear, and hand washing? What can we do to flatten the curve, Nieika?
I would just say that I know we're all tired of being at home. Trust me, I'm a social person myself. I'm tired of it. I'm tired of being limited and confined to my home. But really, to continue to flatten the curve, we've all got to adhere to the guidelines that are set forth by our really national health organization, the Centers for Disease Control, and they're really asking us to adhere to the social distancing. If we are going out, that we're using protective gear like masks and gloves, and that we definitely wash our hands. And when you wash your hands, you're washing your hands for 20 seconds at least, so that we can, you know, make sure that we're cleaning them well enough to remove any virus that may be there.
Mm-hmm. What else can we do to flatten the curve?
I would say, too, please don't procrastinate. If there is something that you see that's not right in your body, please call your healthcare provider. I mean, it's extremely important. I don't want you to hesitate. And when given the opportunity to, please be tested. I know that's kind of crazy, but it really, please be screened so that we can, you know, if we know information, then you know I can't put other people at risk. Let me take care of myself. Let me isolate myself. Let me do, and I know 14 days is a lot because it's 14 days, which is quarantining, but it's worth it. Your life is worth it. And be proactive. I mean, you have to be your own advocate. That's what one of my main things is teaching my patients how to be advocates for themselves. Look, say the best that you can to other healthcare providers. And when they say, you know, hey, well, negotiate your healthcare. Well, do you think I can be tested because this is what's going on with me? So, I mean, I just encourage that. I know it's difficult, but you can do it.
You can do it.
We can.
Mm-hmm. We have every faith in you. So, ladies, I think that you all have done an excellent job of separating the facts from fiction and myth-busting and making sure that everyone completely understands what COVID-19 is, what the risks are, who's not exempt, no one. No one is exempt. We've had a very rich, robust conversation. It looks like I froze. Did I freeze?
Just
You're okay.
Sherica. Just take it off.
I'm
You're
sorry.
freezing a little bit.
Okay. All right. Yeah, I may be freezing. I don't know. It's storming, so I may be freezing a little bit. But just want to make sure that you all know we are so grateful that you joined us tonight. Thank you to Dr. Carla London. Thank you to Dr. Nieika Park. We appreciate all of you for joining us. If you would like to continue this conversation, you want to make sure that you're a part of the Total Woman Summit Inner Circle. So sign up. We have it in the chat. You can sign up at TotalWomanSummit.com, and I have very exciting news about these playbacks. You can get that information by signing up for the Summit Inner Circle and by following me on Instagram at Total Woman Summit and at Sherica Hymes. So, ladies, thank you so much for your time. For everyone that has participated, as soon as this is over, you're going to get a survey. We're going to ask that you do complete those surveys. We would love your feedback, love to hear what you thought about this tonight, how this information helped you. I'm sure these ladies would love to hear that as well. And join us tomorrow as we have conversations about COVID-19 and our money. So thank you all so much for joining us. Have a wonderful evening. Thank you, ladies.
Bye, y'all.
Bye.